What is Ostarine? Ostarine, MK-2866, is a SARM that stimulates steroid hormone receptors, androgen receptors, mimicking testosterone. SARMs differ from typical steroids because of their ability to target specific tissues, such as muscle and bones. This means they have limited side effects. An implication of this is that people who take SARMs don't have to bother with severe testosterone suppression and increased estrogen. As a result of their overall gains, SARMs have in recent times surfaced as a new popular class of appearance and performance enhancers. A whole lot of athletes and bodybuilders speak favorably of Ostarine and claim it offers significant performance gains and muscle mass with few risks. Going by its action mechanism, Ostarine ought to be safer than other steroids. Although it has greater safety levels compared to other SARMs, it has not yet been approved for human use in any part of the world. Ostarine and other SARMs are currently being researched for their ability to improve severe muscle wasting diseases. Ostarine was initially developed to totally prevent complete muscle loss and target muscle wasting diseases. An interesting fact to note is that Ostarine is one of the few SARMs still in clinical trials by GTX, while the majority of the others proved to be too toxic. Ostarine may be approved for future clinical use if the ongoing trial tests can favorably attest a benefit to risk ratio. However, it is almost certain that its use in professional sports will remain illegal. The current standing of things show that Ostarine was banned by the World Anti-Doping Agency under the S1 anabolic agent category of the prohibited list, along with all other SARMs far back in 2008. Potential uses of Ostarine. Bone health. Poor bone health and osteoporosis is usually caused by a decrease in bone protective sex hormones with aging. Though enhancing bone mineralization is important, increasing muscular mass can drastically reduce the risk of bone fracture and speed up recovery. The whole skeletal system is supported by muscles and their strengths, and good health help in healing fractures, especially in older people. Since Ostarine mimics testosterone in the bones and muscles, it has the potential of preventing bone diseases. Studies from animals have shown that SARMs like Ostarine could increase both bone strength and muscles. No human study has confirmed this benefit, however. Number 2. Muscle mass. Ostarine is currently being researched for the reversal of muscle loss in people with muscular dystrophy, the aging population, and cancer patients. During a clinical trial of 120 healthy elderly people, double-blind randomized controlled trial, enobosarm increased fitness and lean muscle mass. Only those who received 3 mg of enobosarm daily for 12 weeks saw benefits. The lower doses didn't work quite well. Its side effects were very similar to placebo due to its lack of steroid-like risks. In a separate trial, enobosarm was able to safely increase lean muscle mass in 159 cancer patients. Most cancer patients who were already losing muscle mass rapidly prior to the study gained about 2 to 3 pounds after taking enobosarm for a duration of about 4 months. The higher 3 mg a day and lower 1 mg a day doses worked equally well. Large-scale clinical trials for enobosarm for preventing muscle loss in cancer patients are currently underway. In rodents such as rats, oral enobosarm was completely absorbed. It is assumed that it could be widely distributed around the body and eliminated through detox pathways. Number 3. Insulin resistance. In the above-mentioned study of 120 healthy older people, enobosarm was seen to have improved insulin resistance and drastically powered blood glucose. It bore somewhat similar effects to the standard anti-diabetic drugs, such as metformin. Ostarine may just be able to benefit people with diabetes or metabolic syndromes. Number 4. Heart health. Another area where Ostarine might prove beneficial is to people who often suffer from muscle wasting and weight loss due to heart disease. In the same clinical trial of 120 healthy elderly people, enobosarm 1 to 3 mg a day lowered lipids in the blood such as total cholesterol, HD cholesterol, and triglyceride. When the lipids levels are healthy, it counters against heart disease. However, the lowering of HDL is not considered to be beneficial. Dosage. It was discovered during the clinical studies that 1 mg a day dose of Ostarine increased total lean body mass by over 3 pounds. The 3 mg a day dose of Ostarine increased total lean body mass by only 2 pounds after almost 3 months in cancer patients. Elderly people gained muscle mass only when using 3 mg per dosage. Pros. It shouldn't cause hormonal imbalance. Increases lean muscle mass and strength. It may improve insulin resistance and lower cholesterol. Only mild side effects have been reported, and it may improve bone strength. Cons. It is not yet allowed for use in professional sports. Long-term risks are unknown. It has not yet been approved for human consumption in any country. Side effects of Ostarine. The list below comprises side effects that users of Ostarine have experienced during usage. They include decreased sense of wellness after first 9 days, testicle pain, no increase in strength or muscle size after 5 weeks, reduces in strength, joint pain, erection difficulties, disrupted sleep, depression, low energy, menstrual cycle imbalances, headaches, baldness, and acne and skin changes. User reviews of Ostarine. We have tried our best to categorize all of the reviews so you can consider that which pertains to you the most. The reviews below are all based on user reports, bulking cycles, milder gains than with steroids, pure clean dry muscle gains, increased protein synthesis, no water retention, increased lifting endurance, strength and stamina, great pumps during workout, no post-cycle crashes, no need for liver support supplements, no increase in aggression. Body recomposition. When using Ostarine for recomping, users reported that they were gaining muscles, gaining some weight overall, and losing fat. Muscle recovery. Enhanced muscle recovery, effects noticeable after a week or two. Better joint mobility, healing of bone and tendon injuries. Improved injury prevention. Cutting and fat burning. No strength loss. Maintaining muscle mass, loss of fat.